Hello, my name is John O'Brien. I'm a pulmonologist, and we are going to spend a few minutes discussing the problem of asthma. These pictures that you see over the next couple of slides are representations of what young people illustrated their perception of asthma as. And you can see these horrifying images of young people unable to breathe. Now, what exactly is asthma? We understand the underlying problem of asthma to be inflammation of the airways or bronchial tubes. It is an immunological disease which is characterized by defects in the control of inflammation. This leads to a condition we call bronchial hyperresponsiveness and narrowing of the airways, which by definition in asthma is reversible. This is a histological slide with a cross-section through an airway showing the normal situation with the mucosal cells well aligned and the disruption that you see with the inflammation in asthma. Now, what symptoms would patients complain of with asthma? They would complain typically of wheeze, shortness of breath, cough, and chest tightness. This is a cartoon illustrating the airway in a patient before an asthma attack, showing the air pipes open, the muscles relaxed, and these are the alveoli or air sacs. And if you take one of those airways and look at it in cross-section, you will see a big lumen, a mucosa, which is normal and muscle. At the time of an asthma attack, there is contraction of the muscle or bronchospasm, as you see here. There is thickening of the lining of the airway or the mucosa, and there is exudation of fluid and mucus into the airways, causing significant narrowing as the problem progresses. This is another illustration of the same process, showing this open airway and a markedly closed airway relating to those processes which end up with the symptoms that the asthmatic complains of. So the components that we see in asthma are airway inflammation, irritability or hyperresponsiveness of the bronchi, and the fact that the airways contract, but they contract in a reversible way. There are many triggers for the contraction, which include allergens of various sorts, pollens, animals, and environmental pollutants and physicochemical irritants such as cigarette smoke, pollution. Cold air is a potent irritant, and there are other triggers such as upper airways abnormalities and sinusitis. Traditionally, asthma has been classified according to severity of the symptoms and the frequency that they occur. The problem with this has been how to treat the patient who presents to the practitioner, and the later severity assessments have focused more on level of control rather than using the term severity. So the asthmatic is defined as being controlled, partly controlled, or uncontrolled, depending on the level of impairment and restriction of activities, and requirement for medications is an independent assessing variable of asthma severity. Today, treatment is usually focused on inhaled treatment with various types of devices, and we aim to reduce the airway inflammation, prevent future attacks, reduce the exposure to trigger factors, provide relief of symptoms, reduce the risk of severe asthma attacks, and minimize the loss of time at work and school absence, and ideally to lead a normal life. What are the types of treatment? We'd like to control the environment The mainstay of treatment is inhaled corticosteroids to control the underlying problem, and various medications to open up the airway and reduce sensitivity. If patients have acute breathlessness, we use bronchodilators to open up the chest. And the treatment is tailored to the severity according to this chart, and there are a number of medications which we won't deal with in detail now. Why do we underwrite asthma? This is essentially, one is looking at mortality and morbidity, and without going through the whole slide, the most important factors to consider in the assessment of an asthmatic and the risk factors for death in asthma is whether they've had sudden severe attacks, whether they've required mechanical support in the past, whether they've required admission to hospital or a number of emergency unit visits, and the patients who have fallen into this criteria within recent times are at high risk of asthma deaths. If they are using a lot of medication to control their asthma, this is also associated with more severe asthma. These are risk factors that are well defined for the treatment of asthma, for the assessment of asthma. But the most important ones for one to remember is to look at the lung function the patient has, the amount of medication they're requiring to maintain that lung function, and the pattern of asthma. In other words, if they have a pattern of acute severe attacks, and if none of these are present, then it is likely that they are not going to have acute severe attacks which are life-threatening.